Hi, I'm Margie with Flow Motion Education, and in this video, you're going to learn how to have a conversation between your hip joint and your brain. In particular, that conversation is going to be carried on between the hip joint capsule and your brain. So we're going to establish a context before we talk about the capsule. So let's talk about the hip joint first, and then we'll talk about the hip joint capsule. So the hip joint is the joint between your pelvis and your femur or thigh bone. And the articulation is a ball and socket. And because it's a ball and socket, there is a lot of movement available in your hip joint. To put it in context of your actual body, I'm going to have you all stand up now. And I've been teaching movement classes, since the mid-90s. And I often like to start by asking my students if they know where their hip joint is. And I will say that most people point either here or they point here. And neither of those are actually your hip joint. So if you pointed here, you are in fact pointing to your pelvis. That bone is part of your pelvis. And if you pointed here, you're actually pointing to your thigh bone. You're a little bit closer to the joint. So we're going to start by finding the joint in your body. And what you're going to do is you're going to put one finger on that knobby bit that sticks out that a lot of people think is their hip joint. And another finger on your pubic bone, the bottom of your pelvis. Below it is air, so the bottom of your pelvis in the front. And if you draw a line between the two and you kind of split the difference, you're pretty close to the actual joint where the movement occurs. So the joints in your body, many of the joints in your body have what's called a joint capsule, which is sort of exactly what it sounds like, connective tissue that encapsulates the joint. In the case of your hip joint, it goes around the joint like this. And just much like this TheraBand, it's got a property of elasticity. It turns out that the way it communicates with your brain is via tension and release of tension. So what we're going to be doing in this exercise is tensioning your joint capsule all the way around the hip joint and in different ways of tensioning it. So we can pull straight across or we can pull at an angle. This will make more sense once we actually start doing it. So we're going to start with the portion of the hip capsule that's on the front of your thigh. And there's going to be a pattern that we're going to use. We're going to do the front of the hip capsule, the side of the outside of the hip capsule, inside of the hip capsule, and the back of the hip capsule. Remember, it goes all the way around your hip joint. And the pattern that we're going to use for every aspect, front, outside, inside, and back, is going to be the same. But we're going to start with the front. Let's all do this together. So go ahead and stand up. I encourage you to have a chair or a wall next to you just for a one-finger touch. You don't get a white knuckle grip, but I want to take balance out of the picture. So I'm going to turn sideways at first, but then I'm going to turn back and face you. But I'm going to come into a lunge position, and I'm just going to start sort of pulsing in and out of this lunge. Now, I'm just going to point out that my heel is lifted. So we're in this lunge. And first I just want to establish, yes, I feel tension on the front of my hip capsule. So you can play with, what I'm thinking of is the front of my hip capsule is sort of going forward in space each time I pulse, but it's also going down. I'm also thinking down. So I encourage you to play with maybe a wider split stance and you'll feel it more, or a slightly narrower one. Whatever width or split stance length, I should say, allows you to feel the tension on the hip capsule the best. That's your position for this exercise. Now I'm going to show the pattern. And I'm going to roll up my pants so you can see my foot, because I'm going to be doing a little dance with the back foot. This is the front of the right hip capsule. And first, I just establish my little pulses. Oh yeah, I definitely feel tension in that hip capsule. I'm getting a nice stretch. And then watch the back foot. I'm going to start pivoting it. With each pulse, I pivot a little bit. And I'm pivoting and I'm turning the foot out. Now the pelvis may want to go with it. I would encourage you to try to attempt to keep your pelvis facing forward. It will turn a little, but don't give into it completely. Now I'm turning back to center, and then I'm going to turn with each pulse. I'm now turning my foot in. So I've essentially arced my foot to turned out, back to center, and to turned in. And I'm going to do that twice. And each time I adjust my foot position, it's coordinated with a little pulse. Again, my pelvis will rotate a little bit, but I'm just not completely giving into it. So now I'm rotating the foot in, and then I'm going to come back to center. And let's do the other side. So again, we start by establishing what position is where am I going to feel each time I pulse, little pulses forward, where am I going to feel this stretch? So you can play with, again, the stride length or the split stance length. So for me, it's right here. And then my back foot is going to start pivoting first out. And with each pivot, I pulse, trying not to give in to letting the pelvis go with. It'll go a little. I'm coming back to center with my back foot. Each little turn is a pulse. And then I've rotated in with the back foot, toes facing in to the midline of the body. I'm going to rotate back to center, and I'm going to do one more full arc. My foot is now rotated out. It's now going to rotate back to center. Each pulse, I rotate a little. I'm going to rotate back in. And then I'm going to go back to center, the starting position. That is the basic pattern we're going to use on all aspects of the hip capsule. The next aspect we're going to get is the outside of the hip. So first, we're going to just establish the stretch. And I'm going to encourage you to shift your pelvis whatever direction you want, but it's the outside of the leg. So I'm shifting to my right, and I'm looking for a stretch on the outside of the right hip capsule. Once I establish that stretch, it might help a little to lean away with your upper body if you're struggling to find it. Once I establish that stretch, I do the same pattern with my foot. Each pulse, I'm going to turn my foot a little. On this one in particular, it's really tempting to turn the pelvis. It will turn a little, but don't give into it completely. My intention is to keep my pelvis facing forward. I'm going to rotate the foot in. Notice each pulse gets a little foot rotation. I'm arcing back to center. I'm going to turn it out again, trying not to take the pelvis with it. I'm going to come back to center, and then I'm going to turn it in again. And let's do the other side. You may not need a chair for this one. So I'm going to start the pulsing going just to establish, oh yeah, I feel tension in the joint capsule on the outside of my thigh. It might help if you're struggling to find it to lean your upper body away a little bit. You can also, again, play with your width of your stance. Once I find it, you're going to start turning the foot. We're going to always start by turning out. Trying not to tuck the pelvis with me. Each pulse is a turn. I'm going to come back through center with my foot. Now it's facing forward, and I'm going to turn it in. And with each little turn, I pulse. Back to center. and turned out again. I'm going towards a turned out foot, trying not to take my pelvis with me. Come back through center, starting to turn it in, and back to center. Next, we're going to do the inside of the hip joint capsule. So again, this is very individual for some. So I'm going to start pulsing. This is the working leg, the one that's out to the side. You can again have a chair next to you. And my intention is I'm thinking sort of this part of my thigh, I'm thinking down, down, down. Now, again, you can play with a slightly narrower width stance or a slightly wider, whatever works for you to feel tension or a stretch on the inside. For me, about right here. Again, we're going to turn the foot out with each little pulse. It turns a little more. My pelvis wants to go with, but I'm not giving in. I'm going to turn it back to rotate inward. My pelvis really wants to rotate here, but I'm not giving in. I'm turning back to center, and I'm going to do that whole arc again. So turning out, turning back to face forward, turning in, and back to face forward. Let's do the other leg. So we first establish the stretch, we get the pulse going, and I'm kind of thinking down, down, down. There's a lot of weight on the working leg. Then I'm going to start, my foot is facing forward. I'm going to start by turning it out. With each pulse, I turn it a little bit. I'm going to turn it back towards center. I'm going to go to rotate it in so that my toes are pointing toward the midline of my body. Back to center. Turn it out. Turn it back in towards center. I'm now coming through center. And one last time, I'm going to turn it in, all the while pulsing. I'm just changing the vector of the stretch on the joint capsule by rotating the foot. And now I'm facing forward again. We're now going to do the posterior capsule. The posterior capsule is a lot more slack than the rest of the capsule, so we have to go further to get a stretch in the posterior capsule. So this one, for some people, is a little challenging to find. If you don't find it right away, don't give up. Just try again tomorrow or the next day. So what I'm going to encourage you to do is come into a split stance, and so I've got my right leg slightly forward of my left, and it's my it's my left posterior capsule that I'm trying to tension. So I've got the left foot slightly back, the right foot forward. It's the leg that's slightly back that we're trying to tension. And I'm going to start by sort of just hinging at the hip. I am holding onto a chair, and every time I hinge, I think of sending my left butt cheek straight back. So I'm thinking back as I hinge down, and I am now feeling my posterior hip capsule, or the hip capsule on the back of the hip joint. And then once I find that, now I'm going to face you. Just pretend I'm holding onto a chair because I don't really need one, but I'm kind of going down and up, but I'm not rounding the back. It's a flat back hinge. And every time I go down, I'm sending basically my sit bone back, and I feel a stretch. Then I'm going to start turning my foot. So it's facing forward. That's the back leg. I'm going to turn it out with each pulse. Again, trying not to let the pelvis rotate with it. I'm now passing through center again, and I'm going to rotate it in with each pulse. Back through center. Turn it out. The foot is rotating with each pulse back. Back through center. One more time in. Toes are now facing the midline of my body, and back to center, and I'm going to put my right foot back, and then we're done. So again, I'm going up and down. That's part of it. It's a hip hinge. I'm not rounding. Up and down. And every time I go down, I'm sending my sit bone back. Back. So remember, we have to send it a lot further to feel tension because this part of the capsule is just way more slack to begin with. So it takes more to tension it. Once I find we establish the tension, then I'm going to start turning my foot, starting by going out. With each turn, I pulse. Back at the midline, I'm pulsing with my foot turning in. I'm going to turn it back to face forward. I'm going to turn it out again. Basically, I'm doing 2 arcs for each joint capsule facet. Do joint capsules have facets? Anyway, for each aspect of my joint capsule. Okay, so we did front, outside, inside, and back of both joint capsules. Take a little walk and see how great your joints feel right now.